on that, we'll kind of move to the next one, autism. Autism is a diagnosis that, again, seems like it's increasing, like as shown in the graph, but it's more so, um, there is some truth to it, but it's more because there's more trained clinicians and more people diagnosing, as education is kind of training, the education system is training the specialists, like, to become, more fluent in the symptoms to look for and things like that. So these are the core features. There's nonverbal communication features with eye contact, or receptive and expressive emotional features that we look for, and then the verbal communication features are very easy to kind of pick up. Atypical speech, those kind of things may be noted, and the emotional processing issues that we notice, as far as awareness, recognition of certain situations, and how they, verbally and non-verbally express themselves, all those kind of things, and the lack of empathy they may have, and lack of perspective taking, all those kind of things are part of the emotional processing that's impaired in somebody with autism. And the social interpersonal processing is kind of correlated with that as well. So they lack the social motivation and awareness. Sometimes, they rather play alone and be alone, left alone, and they don't, share much. So those kind of things are an issue for them. And sometimes they're just contextually not able to understand the social situation. So, and again, sometimes it's tied up with the other features in how they appear to us, with like no eye contact, they're kind of looking away, and but they're absorbing some things, because sometimes they will respond, in an appropriate way or something, but they're responding, they know that they have to respond back or something. Then, we'll come to the severe ones as well. But the abstracting ability, is a issue for them. They are more like, yes or no type of black and white thinking, and, very concrete and literal when it comes to how they interpret certain things. They don't see the gray areas of things. They're not very introspective, or, the self-awareness and the emotional and psychological state of the other person is not really there, also. So they're not really, psychologically minded, right? They don't look into themselves and see their issues, or they don't consider other people either much, and see the issues in the other person. And then the restrictive repetitive behaviors and those kind of things are there. Cognitive behavioral rigidity, with certain routines and things like that, has to be a certain way. And anything out of the ordinary, they'll have a big issue with the transitional difficulty and all that. If, 8 o'clock, this didn't happen, the world is now, over for that day, until the next day they can reset, and next day, 8 o'clock, that same, traditional thing should happen. So when they kind of graduate into the next grade level and things have to change and things like that, it becomes like a adjustment and difficult behavioral issue that teachers are recommending this child will need medication and things like that. Even though if intelligence is somewhat normal, they're learning everything and all that in class. So then, there are also repetitive patterns in some of them, echolalia, repeating things, what they're hearing, scripting, or having idiosyncratic phases, like repeating things over and over, and certain motor mannerisms, like hand flapping, clapping, or rocking and swaying and things like that. Atypical saliences are there, social emotional stimuli, those kind of, things are not really going to help, it's not easy for them. And then there's executive dyscontrol, moderation of emotions, motivations, etc. Sensory dysregulation is also noted. So basically, these are all those different types of features, and the intelligence profile. Sometimes you can kind of look at them and compare them with the intellectually disabled. So if you look at the green and the blue, we mainly look at the intellectual intelligence and the social emotional intelligence. So that's really impaired when it comes to the intellectually disabled. But with autism, you can have either or, maybe just mildly, intellectually disabled, but then socially you'll see bigger impairment, versus the intellectual intelligence may be normal, they may be able to learn, but then again, the social intelligence may be really, lacking in the autism spectrum. So the social emotional intelligence is what we basically kind of compare between all three, right? That is the common thing. Um, so with the common thing, we think of these two diagnoses, and then depending on how they are doing intellectually, they're kind of, either low functioning or high functioning. Um, and every single autistic kid can be slightly different, so these kind of things can vary at different levels. So either way, like, there are also nonverbal kids who don't speak at all, as you can see here, right? The language skills and social needs also is something that we compare. So this kind of, gives you an overview, and this is just a graph on how the intellectually capable group is actually on the rise, because parents are seeing that, their child has certain features and they just want to be sure, because they're not academically successful and different things, and parents are actually, learning about autism more and more, bringing more and more kids, to get diagnosed. Um, so that's why, otherwise, the intellectually impaired, obviously they're also getting more diagnosed, but not as much. There's a bigger, difference here. And some of the same things I mentioned here, is just kind of shown between the intellectually impaired and the intellectually intact. Some satisfactory eye contact. So even with autistic kids, like, eye contact may not be the only one. It may be hard to tease out if the eye contact is what you think, separates somebody from being autistic and, non-autistic. And then also the social interests, right? We can't just look for the social stuff. There are some autistic kids, or intellectually, intact kids, that will kind of mimic certain, social behaviors that you may not really pick up on their, autism symptoms and all that. And again, um, it can be a difficult, diagnosis, like, for parents to deal with, and they definitely need a lot of support. The younger the help is given, for the more impaired kids, the better the outcome can be. So um, anyway, I have a couple of families, who parents are very intellectually, capable and all that, but they have autistic, sons. And so again, I brought that up because it's more prevalent in male than female. Just wanted to put that out there as well. So, any questions or anything related to that? So I know it's more heavy right now with a lot of the different diagnoses that we're going through. So the next one is like a history of how DSM,
Oh,
um,
okay. Yeah.
with autistic kids, they used to call them, a schizophrenic reaction childhood type. And then by DSM-4 in 1968, they were kind of classified as, schizophrenia childhood type. And then they came to pervasive developmental disorder as just the, nomenclature of diagnosing the same autistic kids at the different, stages. So at this point, we are kind of pooling them all into autism spectrum disorder, and then we just, either classify them level one, level two, level three, like that, in like high functioning or low functioning and things. But yeah, these old, you know, diagnostic criteria and all that, um, is kind of thrown out. But you can see the evolution in this. That's all. Asperger's was the high functioning autism that people have heard about, and then the rest were either put to, like, if they had doubts, they were put into like PDD and OS. It's pervasive developmental disorder, not otherwise specified. Or if they are clearly autistic, they would definitely put them in the severe autistics, were in that group. So, but this actually, the model changed from this to this, from DSM-4 to DSM-5. to just have one name because the services provided, were different. If you had an autistic disorder diagnosis, you would get more services, but less for the Asperger's and PDD diagnosis. So the parents definitely complain because the parents definitely still can't raise an Asperger's kid that easily. So they rather be diagnosed with autistic disorder to get the services. So then because of those kind of parental uproar and all that, and obviously clinicians also seeing that yes, that child definitely needs that extra help through the school system and different available resources with therapy and all that, they decided to go with just this one you know diagnostic label. Okay.
Thank you,
So
Binu. That was
yeah.
really informative and so
Mhm.
much, so many different mental illness.
Yeah, no, we didn't get to cover the it's going to transition to schizophrenia as well, but anyway, this is like
The
a slide that
schizophrenia, can I just see the slides? Don't have to talk, but I just wanted to
yeah.
see slides of
Yes, there's
schizophrenia.
positive and negative symptoms. Positive
What's the
symptoms are
symptoms?
yeah,
Delusional.
so delusions, hallucination, disorganized thinking and speech is the psychotic stuff, or positive symptoms. The negative one is like the lack of normal emotions, and we call it alogia, and such as having flattened affect or lack of motivation. So they just don't smile. They just have this blah look, of a masked face type look, and they don't.
Can it be
Uh,
reversed? Schizophrenia?
so not truly, Yes, you can treat most of the symptoms, and they also kind of, can fall in a spectrum, where if they're severely psychotic and delusional, it's hard to, get them back to, functioning normal, but they could take medications and be free of those symptoms, but they may already be going through more cognitive issues and things like that, because that's another problem they face. They can make good decisions and all that because their executive functioning and memory, all that is affected as they're aging. So if the disorder is diagnosed later in life, actually they get through most of the educational years, and they actually do better. They can function, and with medication and all that, they can hold jobs and those kind of things. And sometimes they were normal folks who just became schizophrenic like in some way or the other because of drug use and things like that. And giving up the drugs alone sometimes is not the fix. They still need the medications to keep the symptoms that are longer lasting. And sometimes when they go off of medications, like most disorders, they go off of medication and they'll end up with the symptoms again.
Mm.
So that's like another way of telling that they're not ready for tapering off of medication or anything like that. So yeah, then it's just the same type of um, information within these kind of different graphic slides, negative symptoms, everything, and then there's that new neurodegeneration happening, and the cognitive symptoms, um, being present and all that. So these are some of the stats, but as you can see, the neuroanatomic abnormalities will be there, the environmental exposures and drugs, those kind of things could be there. And then there's psychological and social factors to think about, how they affect, their family members and, their own, life. And then genetic factors are there. And, with the psychological and social factors, we could say, small things like usually strict households where parents have been very rigid. And again, this is a theory. Um, those are the households that the kids end up, not having any kind of freedom. And again, this is going back to like authoritarian type parenting. And then anyway, last week, we did a presentation at um, one of our churches in the Pentecostal church near us, and so it was a bunch of mental health professionals doing it, and afterwards, like a mom came to me and kind of said like, oh, my son is in a state institution now, he has schizophrenia and all that. And she's a nurse, and she understood how the father was like very strict, wouldn't let him have anything his way from a very young age. And she tried to talk to the dad and this and that, but father would never change. Father was, had his own issues, but he didn't realize how he was affecting the child, and now the child is state institutionalized, Malayali family, and there are so many others like that. I know in our church there's one brother taking care of his younger brother for many years. The older brother is unmarried because of that. Just because he's taking care of the older brother. Like those kind of things are there. So it's unfortunate, right? But this is, sometimes related to some psychological, social factors and
So
environmental.
how do they live like as they grow older and towards the end of
Yeah. So
life?
yeah, like if you're in a state institution, like, at least there's medical care, and they still kind of, are monitored. They do get to go, outside to work if they're able to. And sometimes it's just menial work, like a janitor working somewhere, or working in the food industry, those kind of things. And, when they come back to the state institution after they go to work, um, again, they are given the medications. The nurse is there, they're monitored, and they're in a safe place, and not outside, using drugs, different things like that.
I
So yeah.
think, but this
Mhm.
is good information. These are realities that we face.
Mhm. Yeah. So
So
anyway, there's
anybody
some,
wants to ask any questions? Probably not.
yeah, these are a bit of a hard hitting diagnoses and all
Yeah.
that not everybody faces, but definitely it's in our community as well. So,
Yes. Yes. Yeah.
all right.
Thank you, Binu. Thank you for staying up so late.